So the World Stem Cell Summit is one of the major gatherings of the whole community of regenerative medicine, highlighting the advances of stem cell biology and regenerative medicine today. Indeed, this 8th annual meeting will be an opportunity to hear from some of the most prominent leaders in the field, but also from patients, advocates that are promoting this emerging transformative field of medicine. Regenerative medicine has evolved indeed from being maybe a science fiction in many of our minds to increasingly becoming reality. There have been major technological breakthroughs that have allowed knowledge to be gathered and ultimately to move that knowledge into applications for our patients. So major healthcare centers, including the Mayo Clinic, has indeed highlighted regenerative medicine as a strategic initiative. And specifically at the Mayo Clinic, we have recently launched the Center for Regenerative Medicine as an integrated structure that brings together our discovery, translation, and application within the regenerative medicine space. Let me try to highlight the significance of regenerative medicine and why there is so much excitement worldwide with the successes of regenerative medicine. Medicine today is largely capable to address what we call the signs or symptoms of disease. But unfortunately, we're rarely able to address the really underlying causes of disease. With regenerative medicine and with the whole revolution truly in technologies, we are increasingly able to offer what we call definitive solutions to our patients. In other words, going after the root cause of the problem and hopefully one day offering cures to up to now incurable diseases. So regenerative medicine is after restoration of both structure and function. And the successes are multiple. They have started, for example, in hematology, where we're able to treat today incurable diseases of the past, such as leukemias, lymphomas, myelomas are now indeed increasingly curable across the ages of patients. Similarly, the knowledge that has been learned from hematology and from these early successes is being now translated in other fields of medicine and surgery. For example, in orthopedic surgery, we're able to offer to patients alternatives, let's say, to hip replacements with technologies such as minimal invasive hip decompression being one example. Similarly, in plastic surgery, there are increasing regenerative surgical procedures that are available to patients in order to reconstruct, let's say, a failing organ. We believe that in the years to come, as the technologies become even more advanced, there will be even stronger presence of regenerative offerings to our patients. One unique activity of regenerative medicine within Mayo Clinic is a regenerative medicine consult service. This is indeed a very unique portal that patients can use to learn what are the most innovative frontiers of regenerative medicine that are being offered for their particular condition. And we have had so far a wonderful experience with patients that have been asking many of the questions that are indeed pertinent to their cases, and we have been able to offer advice as to what is available today for their condition. The main breakthrough in regenerative medicine has been the increasing understanding of our own body, how our own body can heal. Many of the mysteries of regenerative medicine are actually from within ourselves. You know, if we learn how an organ can heal, let's say skin, if we cut our skin, it will heal perfectly. How that process is happening can teach us how we can then intervene in conditions such as wounds and ensure that wound healing will be perfect. Or, for example, patients can give part of their liver, for a patient in need. The remaining part of the liver will regrow. If we learn how this process happens, then we'll be able, let's say, to give other parts as needed. And in that regard, there is a whole field of regenerative medicine that is evolving that we call neo-organogenesis. In other words, creating new tissues based on the understanding of the healing processes from within. Indeed, regenerative medicine is viewed as one of the transformative dimensions of modern medicine, and we don't know really where is the limit, but I think we have at the same time to be careful to, in a wise way, first of all, address the safety and feasibility of this type of technologies, as we're evolving increasingly to advance the efficacy as well.